Good morning. Welcome to the Knox County Board of Commissioners, June 4th, 2026 meeting. This morning we have Knox Public Health with us, and Zach, I'll let you introduce yourself and partner, and the all
Thank you.
floor is yours.
Yeah, appreciate your guys' time. Good morning. Good morning. I have Mr. Anthony Bowerstock with me. Anthony's been with the agency coming on 2 years. Anthony has been promoted. He oversees as a project director over our community health center operations. In addition to, he serves second in command, so he'll be the deputy health commissioner for the agency in the event that I go on my trip and I don't make it back for whatever reason. I got continuity now.
Is that why you brought him in?
That's right. Yeah. Hey, just heads up. This is who you'll probably be dealing with moving forward. So Anthony, if you want to introduce yourself.
Yeah, in Bowerside, born and raised West Central Ohio, Wayne County. So I've been home for a while, then moved to Georgia for a little while, Louisiana for a little while. Came back home in 2010. So on this side of the state now versus the other side of the state, but glad to be a part of the team here in Russell County. Currently living in Coshocton County, so close by, but not too far close by.
Did you move out of those two states on your own free will and accord, or were you asked to?
No, I was pretty well, yeah.
The question is, are you welcome there?
Yeah. Louisiana, love the people, love the food, did not like the weather. It was a little wet to say the least and humid, but yeah, glad to be back in Ohio where we have all 4 seasons in 1 week. So
yeah, in 1 week. Yeah.
Yeah, no, Anthony does a great job for us. He comes from the Ohio State University, so you can't be mad about that. No, I'm glad to have him, and it really creates succession and continuity for us as we continue to move forward. So let's jump right into it. The Ohio EPA funds that you have in front of you for the water pollution control, that is an ongoing opportunity for our county. In particular, we've been leveraging our township trustees to ensure that they recognize that these funds are available at a state level in the event they have residents within their area of failing septic systems. Typically, that becomes knowingly from neighbors reporting those acts. We were awarded $175,000 for this upcoming cycle, which I believe last year was only 75. Over the last 7 years, 5 of which, most recent 5, we were able to draw down all those funds from the state. So in the event that our community doesn't need them or ask for them, it stays at the state level. So we've been really pushing hard, working with our trustees, zoning and officers to be able to get those funds into our infrastructure within Knox County. And 175,000 is the most in my tenure with the agency that we've actually been awarded. So I wanted to provide that, Cheryl, if you could really continue to put that out there. This is the fact sheet that we provide on our website. The average homeowner, and I don't blame them, I'm right there with them, is not going to be forthcoming necessarily to say, hey, my septic system's failing, because it's expensive, right? So we created this fact sheet to show household income based off of size to see what subsidies at the state level we can bring.
And is there a max that a homeowner is eligible for?
So it just depends on their qualification.
But as long as they're eligible and you can cover the cost of the.
And here's the thing, the team's done a great, the environmental health team's done a great job of identifying contractors. So we'll write the grant for them, do all the administrative work. We already have individuals set up to go in and do the work for them. So we're trying to streamline it to where the average individual is not burdened with trying to learn what all this is. I mean, we all live that, right? Yeah, you got a grant you can apply for. Well, where do I even begin? So being able to streamline that internally has paid dividends over the last several years.
So we've had, you said last several years, so we've had several Knox County people benefit from this.
And we continue to have those applications coming in.
Good.
Yeah, like I said, so the 75,000 most recently was completely allocated and encumbered. We had 150 the year prior. We spent all of that down. So 175, and we have people on a wait list right now.
Real good for you.
Right, so we have participants.
We
that
do.
Ask people to do this or let them know to do this. It's
Yeah, and honestly, the township trustees being a driver for that, just because they're boots on the ground, right in the roots of those areas, to be able to say, hey, I get it. Like, just read this and let me know, right? So no one feels like they're being targeted.
Yeah.
And
just in a ballpark. With the funds that were allotted, about how many septic systems would that do?
it really depends on if it's just a rip and replace, if it's a repair, maybe it's a holding tank issue. Then you start getting into what's the soils look like of what system needs to be put in. So for 175,000, we could probably do 7 to 10 would be probably a good number between replacements and or repairs. But depending on the system you have mound system, if you need UV lighting, mechanical, you're talking north of $30,000 for a replacement of some of these systems. So that's highly important to recognize that that's a financial burden for many of us, especially if it's out of nowhere. Most of the time, it's like, well, if I flush the toilet and it goes away, I'm not going to deal with it. I understand that, but how do we continue to ensure neighbors' wells don't become compromised during that time?
And you would think it'd be older homes that we'd be talking about, right?
Yes, I think the older systems, but in today's world, who knows? Right? I mean, if a
Until
holding
you build
tank's
it.
failing because it was bad in production, it could be a pretty new system, right?
Mhm.
Or if you needed to make a lot of mechanical work to be able to shoot X amount of feet upgrade and that fails 5 years in, that becomes problematic, right?
Yeah.
Kind of on the same lines regarding sewer, House Bill 692 looks to change some of the sewage laws in the state of Ohio. So I'm just bringing that to your attention. We the Association of Ohio Health Commissioners, I serve as a board of director. We are working with those co-sponsors to be able to introduce a substitute bill. The O&M program, operation and maintenance, a 10-year re-inspection of the system is on the chopping block. I don't want to speak on behalf of the association, so I'll speak on behalf of Knox Public Health. That's not realistic. It's not sustainable. And frankly, it going away or at least being optional for jurisdictions to leverage, that's okay. It really is. I'm not going to knock on your door because you've lived there for 10 years. Hey, Barry, it's my turn to check your system. And you're like, my system's fine. Why are you doing my problem? I get that. I respect that. And we're not in a position, nor should we, to be going and randomly checking all these systems.
Right.
But it's fine line. How do you ensure that those don't become problematic in the future? So the O&M's on the chopping block. We're in support of looking at it as more of an optional place across the state. The one element that really scares me the most is removing soil tests before putting in the system. Yes, the argument across the state, not so much in Knox County, getting a soil scientist in
Yeah.
a timely manner has created some uproar, in particular realtors.
Sure.
And I get that. I mean, it's a business, right? Like we need to be able to move, but not testing the soils to really determine what's in the best interest of the system you're putting in based off of fall. We're going to go backwards in some of our innovation. And we're just going to be like, yeah, well, we don't know what soils are. So does that cost you more money because we got to upgrade your system at the highest level? There's just arguments to be made, but I understand the concern of being timely as well. Fortunately for Knox County, I'd say we're 2, maybe 3 weeks to get a soil scientist out and a report. I'm not saying that's common across the state. So I do respect where that's coming from, but that's the only one for me. And looking at some of the sub-bill language, that we're really like, we got to find a way to still be able to test the soil. So we're doing as much mitigation efforts moving forward and not charging homeowners abundance of money because it's in their coffin.
Right.
So how do you balance that, right? How do you balance that? The 1-year inspection, some of that language is changing to more education. So it's not an inspection, it's a brand new system. Individuals that come from typical water and wastewater infrastructure like the city that move out into the country, they may not be familiar with how to change the legs on it, how to ensure you're spraying out the holding tank and the screen. So then they're like, well, I got septic backing up in my drains. Well, you haven't sprayed out your screen in 4 years and it's backing in, right? So it's more of just changing some of that language to ensure it's educational driven.
Did they actually knock on doors?
We never did. Yeah. We never actually hit the 10 years. It actually started in 2017. So we're just getting to that point. The only time we do the O&M program is twofold. One, it's a brand new system. So then it starts on a 10-year frame, or we get a complaint and then we go in and we do our inspection like we typically would. And then it starts that 10-year. But no, and we just, not because I'm like, oh, we don't want to go on people's property. The reality of it is we don't have the ability to go and hit. There's no way.
Manpower knocking on doors.
It's not realistic. It's
Not only knocking on doors, but having the ability to, after you knock on it, to actually do something.
Sure. Yeah. Yeah, so that's how we've been navigating it. So we'll see how that House bill turns into. But it's safe to say that our sewage laws in the state of Ohio will be changing. Yeah, I'm adamant about
Again.
that. Yeah. Lyme disease. So currently where we are year to date, we have 35 cases, where we were this time last year. First part of May was 22, so we're going to continue to see that climb. Again, recognizing that this is time of the year where ticks are most active, but recognizing again, 35 cases into May. We're finding ourselves more and more in conversation of people contracting Lyme in February. And I know I've been pushing this education, but just because it's dead of winter, and we had a heck of a winter this year, didn't stop. So we need to continue pressing that education. And I'll let Anthony talk about some of the tighter opportunities locally to be able to test for that. But
What do they think is causing that uptick here, not only here, but yes, nationally?
well, it's
Well,
migrating
more-
west, right? So if you look at just the overall epidemiological response of Lyme into Connecticut, right? And as it continues to migrate west, you're going to see, if you start looking at some of that maps on the East Coast, it's not that it wasn't there. It's just finally getting to the point where Central Ohio is becoming more and more of a hotspot.
So it's marching across the continent.
It is, yeah.
You still hand out the tweezers.
We do.
Yeah.
We do. Yeah. And I actually tested those. I think I told you guys. I used it on one of my kids. And I was like, this ain't gonna work. And it did. It worked great.
That's one with the little slit in it.
So yeah, there's two different. Yeah, it's the tweezers and then to be able to pry it and then back in as well. Tick identification. The agency will continue to offer tick identification. We do not test for Lyme disease. I don't know of any lab in the state of Ohio that does test for Lyme. Here's the misconception. Individuals believe, well, if I just test it and if it doesn't have Lyme, I'm good. Well, that's all great and well. Testing it is probably extremely difficult. I don't know any lab in the state that does that. And two, just because it has Lyme doesn't mean that you contracted Lyme. So we don't want to dispense doxycycline on a regular. I mean, it's a heavy prescription, right? To where individuals become immune. And that's the bigger concern looking into the future is if we're just pushing doxy constantly, what point does that no longer work? Lyme disease can be lifetime chronic. So we'll continue to monitor ticks in general, but the population is growing.
So why I saw some social media, which anyway.
Yeah.
Hit me
said
with
it-
your wisdom with this one,
yeah,
Mary.
It says that you should save that tick and maybe tape it to a piece of cardboard or something. What's the reasoning for that, or if any? Does that make sense?
The only time that I would say save it is if you were interested to know what type of tick it
I think
is.
it is. Okay.
Short of that, I would say
Yeah.
eliminate it.
That's what I thought.
And I'm not saying eliminate it like flush it down the toilet. It's amazing. Ticks are very resilient and they can live weeks on end on just the air bubbles on them. So
Really?
just flushing down the toilet doesn't mean it's going to kill
Really?
Yeah.
That's what
I recommend cutting them in half.
Yeah.
Yeah, if you get them
Yeah.
to hold still, right?
Yeah,
Well,
right, yeah. Just don't cut yourself, Barry. All right.
Yeah, crush him. Got it. You learned something.
I want to give a thanks not just to the commissioners, but Jason. We continue to collaborate. It's been awesome. I do appreciate that. It makes us just better as a community organization. But IT backup and some things in the pipeline. Thank you. It goes a long way. And sharing those resources and not being redundant and being mindful of taxpayer dollars is something that we do extremely well. So thank you for that. We're looking to partner with our local American Red Cross. They reached out, their local chapter in Mount Vernon. They're losing their square footage here in downtown Mount Vernon. So we drafted an agreement, non-monetary, just in pure partnership that they're going to be at our main site a few days a week, just to have some disaster supplies even in our garage. Likely we'll park their American Red Cross vehicle in our parking lot so they have access in evening hours, middle of the night hours. For response mechanisms. So it's a great partnership. It's in the pipeline. I have full expectations that will go through and we'll start June 22nd.
That's nice.
So with that, Anthony, I'm going to turn it over to you, buddy. Reference to kind of PCMH.
Yeah.
Give them update on that.
First off, thank you all for having me this morning and we're currently in. PCMH, certainly our patient-centered medical care. We are recognized as Knox County General Health District as a patient-centered medical home.
It's PC what?
PCMH.
Okay.
Patient-centered medical home. It's something we've been striving for, what, for about a decade?
Almost a decade.
Yeah. COVID-19, the pandemic kind of took a turn with recognition, but we are glad to finally achieve it, certainly. With regard to service lines and how it kind of interacts with the agency, patient-centered medical home recognition is about collaborative care. It's about team-based care, chronic condition management, kind of the collaboration of all those and how they work together. So essentially accreditation is the kind of way it works. There's certain core measures and elected measures to get us there. Whether it be ensuring our teams work together, we're performing case management with our patients to make it all kind of sync and work together, certainly. Long-term kind of overarching for our county here, certainly, reducing ED visits as one. Again, ensuring the patients and clients we have within our service lines can manage their chronic care conditions and go from there. And overall, kind of the larger picture, reducing cost related to health concerns through those chronic conditions and their management of it. So, yeah, exciting. It's been a team effort, certainly, to get us there, pushing through to the finish line, and it only builds from here. So, yeah, exciting news. Kind of on the same line, Project Adam. We are a Project Adam site as well, one of our location sites. Career Center is also one of those. That's more related to cardiac care and management. So ensuring we have the policies, procedures, people in place to, if there's a cardiac emergency, get people the treatment they need and kind of move them down the line to advanced care. So yeah, excited to have that in the pipeline as well.
So on the PCMH, who would be the people that you would want steered towards that program in the county?
Yeah, it's for any person in the county, certainly, any of our patient population, those with chronic conditions, diabetes, hypertension, things like that, certainly, so we can manage their conditions. And it's about collaborative care too. So we offer, of course, medical, dental, behavioral health, ensuring all those service lines come together to speak for that patient and to make them live the best life they can.
So if they think that it would be something they would do or need, they contact you guys, or are you going through doctor's offices and letting them know it's available?
Yeah, so both ways. So if there's something we can do at Knox County Community Health Centers, we're glad to do. If it's something we can't do, it's beyond our scope, certainly referral out to somebody else.
Okay,
Yeah.
good.
Maybe you talk about collaboration, bring them up to speed, or collaboration with children.
Yeah, certainly. So as we also know, we partner with KCH, but a larger collaboration. I'm kind of expanding from that, the lack of pediatrics. Currently with KCH is our partnership with Nationwide Children's. We've been working through them more of an educational kind of perspective with our nurse practitioners. I'm trying to work through those guidelines and how we can best kind of collaborate. We've been seeing definitely an uptick, kind of double-digit numbers actually, with the number of pediatric patients in our clinic setting. From the time where pediatrics has been challenging for KCH. Getting better certainly, but our levels of demand are still there. So how we kind of work best together.
Yes.
That's been great. Yeah.
So you kind of a one-stop shop, so to speak now, right?
Yeah,
Peds.
I mean, well,
Yeah, kind of, you had
within
dental,
reason,
you have dental. and
that's where
everything.
opening the door to all these
Yeah.
additional community resources. Saying, look, we may not have all the answers, but we're tied in an alliance to be able to
Mhm.
make a phone call
Sure.
to somebody who does this day in, day
That's
out,
great
on the
work.
top of the line, children's rep that,
Mhm.
hey, I got them on the phone,
Yeah.
you know, here's
It's good
be able to
work.
be where you
Good
are.
job.
And it's not just pediatrics too, certainly with behavioral health, we're doing behavioral health integration. So kind of these form handoffs where maybe a nurse practitioner sees someone that may need a little mental health assistance. And our psych nurse practitioner is right there to kind of get that warm handoff and take them in. So those balancing acts is certainly something that we can improve on, and we are. So.
Good.
Update us, or especially me, on facilities.
Okay.
Because there for a while, we're going to build here and we're going to do this. Where are you in the facility that you're using?
So I appreciate you asking. We're not looking to build anything at this point in time, and it's two-pronged with that. One, ongoing just barriers financially of what we're seeing, even at a federal level. We took a significant cut in reimbursement through Ohio Department of Medicaid. The agency lost almost $800,000 in February in reimbursements from ODN. Looking at it through that, and then obviously the threat of axe the tax that's looming out there, we're at a good capacity level that our throughput or wait times are not anything significant. If anything, I would say dentistry, looking at some dental operatories, maybe in addition to at our main site, just to help some of that throughput. But the vision as we acquired the property downtown on West Vine Street was, hey, let's move all our ops downtown to be central, right?
Yeah.
Well, me and you both know the amount of growth that has occurred on the east side of the city.
Yes.
It goes without saying, it would be detrimental to our community members to take resources on Upper Gilcrest away. So knowing what that growth is, some unknown factors financially, ensuring that we have sustainability. Look, born and raised there. The last thing I want to do is say my capstone in my career is I'm putting a brand new building down here. Well, that's all great and well, and I don't mind having those visions and having those conversations with partners. Does it pay dividends for the future of this community? And frankly, what we're currently doing meets that need. Mental health, so behavioral health services, we currently rent 4,000 square feet on Mulberry Street. That's the only thing that I see at this given time that is a priority. What happens if that lease goes away or we run out of time? 206 South Mulberry.
Mulberry, yeah.
And looking at overall community need, where am I going to put 9 counselors tomorrow? Right.
Yeah.
And when I look at threat and liability and sustainability. So if there's any growth, new build, expansion on the West Vine Street today, my answer would say I would look at doing something for behavioral health services, ensuring our psych NP is able to collaborate in that manner. Short of that, we're doing well in square footage. I mean, heck, we're bringing American Red Cross in to help out. That was not the conversation 3 years ago. Matter of fact, Cheryl even did a story, right? I remember speaking to the city. You know, we're looking at a 1-year plan. I need a 6-month plan. I'm out of space. So we're in a good spot, but strategically, we're calling it the silent phase of evaluating some of those unknown variables to determine what the need of the community is. As we all know, those things change, and I'm ready to pivot at any given second. But as far as any future growth outside of mental health today downtown, I'd say we're on hold, and we're just in straight evaluation and in a good spot square footage right now.
Good. Thank you.
Yeah, for sure. Anything else?
Just like yesterday's acceptance luncheon, awareness and acceptance luncheon was great. That was wonderful, very touching,
Yes,
being a good neighbor.
yes, yes. Dee Dee does a great job.
That's off to Scott. I mean, Steve.
Steve, yeah, Steve does a fantastic job for our community. Yep, for sure.
Appreciate it.
No, thank you guys.
Thank you.
Welcome aboard.
Thanks.
Yes. Thank you, Anthony.
More soul.
Yeah.
That's what they keep telling me. That's what.
If you guys have any questions in particular to those funds for sewer, let me know. It's not for brand new, it's for existing if we need to fix them, replace them.
Good to.
All right.
Happy hunting.
Is there one section in Knox County that seems to be using?
No, yeah, there's no pattern to that at all. It's been pretty consistent all throughout, which is a good thing.
Yes, good.
Happy Boeing.
Yeah.
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 And with regard to line titers, if you have any questions or concerns,
Yeah.
please feel free to reach out.
To be able to check, it's a blood draw, to be able to check and see if you did contract Lyme, get you on the right regimen.
Does it show up right away though? With Lyme disease?
No, I would say not. I typically you start seeing symptom onset on around day 10.
Okay.
But as far as the blood test, I couldn't tell you how soon it would show up on that, probably sooner than symptoms, but hey, I got bit and it's been 24 hours. They're not going to test for that.
So if I get bit and I do the blood test, treatment for it, is there antibiotics you start giving at that point?
Yeah, the doxycycline typically a
Okay.
2-week regimen and maybe more depending on the severity of illness, how long it's been. You've been fighting it too. But yeah, doxycycline.
Success rate's been pretty good with that.
Actually, yes. The success rate unfortunately does start to falter some depending if individuals don't start treatment
Yeah.
until it's 3 months, 6 months, even a year, right? Because maybe you just can't figure out what's wrong and it's
Yeah.
not being identified yet.
Yeah.
So
Yeah.
sooner we capture it like anything, you're better off.
Yeah.
Good.
Thanks for the input.
Thank you.
Jason, have
Have
at
a
it.
good weekend, guys.
Thanks, you too.
Commissioners, we have the letter of support to approve for the North of Vernon Housing Development. I did check with St. Philkins, and that 5 years on the sample letter was valid. That's related to tax credits. So there's been nothing within 5 years related to tax credits. So that's ready for your approval and signature.
Okay, so moved.
Second.
All those in favor say aye.
Aye.
Oh, and one follow-up too, I know Doreen had asked about that, why they didn't get the funding last year and they're reapplying. So apparently they did score extremely high. But it was only gonna be 100 units, and so it lost on size. So this time they've acquired some additional property, it'll be 130 units, which they think will get them sort of threshold. No, this is up on Sandusky.
Where the old Snyder's, where the Snyder's junkyard used to be.
Yes, yeah, yeah. So I think those were your two questions that you guys have on that. So you're welcome. Then we approved the website and license agreement between the Knox County Auditor and Pivot Point Partners LLC. This is for, I believe, Andrew, do you know this software? Is this for their new, new tax software, correct?
I believe
The
so.
real estate side.
Yes.
That they're gonna switch to later this year. Yep. And this will be paid for out of the REA budget.
So moved.
Second.
Those in favor say aye.
Aye.
And then, well, there's two spots on there you'll need to sign. Then we have a professional services contract between the Knox County Office of Homeland Security, EMA, and the General Health District. Zach was just talking about this as partnership. So, as I think you're aware, J2 Deshaun is resigning effective, June 12th. It's going back to Fredericktown PD. So on, sometime in June, we will most likely be promoting Amy into that director role. The funding for that has been a little bit sketchy, as of late. And so, I kind of took this as an opportunity to pull back on that budget. We subsidize through the general fund about $116,000 a year to EMA. By doing this, we'll probably free up between $50,000 and $60,000 in savings to the general fund. So what we're gonna do is, we're gonna kind of go back to the model that we had years ago, when actually Zach did this, when he started out the health department. But the health department will have a full-time employee, and we will contract with them, and we will have that employee work 16 hours a week for Knox County EMA.
EMA.
And so we will, the contract amount will be for $34,112 a year, which is a significant savings over what we were paying for a full-time secondary position. So this will pick up quite a bit of savings. It should be at least 50 to 60 and maybe even a little bit more of a savings to the general fund by doing this versus hiring a full-time employee.
And we will be moving that office down to the business center.
We're still waiting for the price estimates, haven't come in, but if all goes well, yes, we would move them out of the sheriff's office down to the
I think it's a great move.
business center. Yeah.
Great move.
Well, so moved.
Second.
All those in favor say aye.
Aye.
And I guess just a word that Mallory for that resolution is they're actually authorizing me to sign this because Zach and I have this set to sign. So.
That is on the
Yeah, the way
resolution
you
tab.
did it.
Yeah, okay,
So we're good. I'll sign that. Okay, thank you.
thanks.
Then we have approved the bus facility program, state fiscal year 2026 sub award, and this is from the Ohio Department of Transportation. To Knox County Transit for $132,298. This is just normal funding.
Motion to approve.
Second.
All those in favor say aye.
Aye.
Was there anything, this just says lets Bethany sign it, is that correct? Or is there anything for the commissioners to sign on this?
I
Believe so.
don't think on that
I
one,
think it's just for Bethany.
Yeah.
Okay.
the other two we just stamped on, but the commissioners just.
Perfect, perfect. Okay, then we have approved the procurement policy for transit. They're required by the state to have their own procurement policy.
So moved.
Second.
Those in favor say aye.
Aye.
That will require all of your signatures. And then approve a federal transit administration, Title IX program for Knox County Transit. Again, this is required for their federal funding.
Motion to approve.
And second.
Those in favor say aye.
Aye.
And then we have the county engineer has these contracts ready for the 2026 annual resurfacing to Smalls asphalt paving in the amount of $822,263.41.
So moved.
Second.
Those in favor say aye.
Aye.
And the last item is the memorandum of understanding between Knox County Job and Family Services, Knox Public Health, for the contracted homeless 14 coordinator position, and this is for July 26th through June of 27.
Motion to approve.
Second.
Those in favor say aye.
Aye.
We have couple sets of minutes and the bills there for you to sign. That's the shall. Bill, it's the same these. So it says, see, ridiculous, that's 3 of those. And Commissioners, I don't have anything else for you today other than that.
Mr. Purcell, do you have anything you want to share?
Yeah, there's a lot of stuff that's been reported in Knox pages, and I thought I'd share that with the people. The Danville girls softball team. They play in the state championship game today at 5:30 up in Akron at Firestone Stadium. So congrats to the girls that'll be going on that trip. And this is their third time to be in that state game. And they won it back in 2008. So the girls have done an excellent job. And then there's been a lot on the track side. Calvin Heighthouse, which is the son of David Heighthouse, and our park director, he'll be running, I think it's Sunday, in the 1600, and then Jamie Oakes from Mount Vernon, he's running in the 400. Lucy Rush running actually 2 events, 1600 and the 3200. Chloe Bradley is doing the shot put for Mount Vernon. Kennedy Howard doing the pole vault, and then the Mount Vernon girls 4x400 relay is also be running in. There's several, East Knox and Fredericktown and Danville. East Knox has Case and Fawcett running in the 400. Weston Bostic's doing the pole vault. For Fredericktown, Cooper Ryan 110 hurdles. Their boys 4x200 relay, and the girls on Alan Boughton's doing the shot put and discus. Jenny Alexander's doing the pole vault. Danville boys, Owen Gronberg's doing the shot put, and these are all at the state level, you know. And then the girls, Danville, Kelsey Hackman, she seemed to be the like the Jim Thorpe of Danville. She's running the 100 hurdles, 300 hurdles, and also the long jump. So she's in 4 events at the state level. And then the East Knox, Isabel Bostic doing the 400. Danville girls, Brooklyn Carter doing the shot put in the discus. And then the boys, or the girls for East Knox, they're doing the 4x100, 4x200, and the 4x400. So I just impressed by all the athletes in Knox County that are going into the big show. Then I wanted to mention that next Tuesday on the radio line, Cameron Keaton's going to be talking about his 225 annual report and on all the projects that he'll be doing this coming summer that the county will be doing. So we're pleased to see so many things happening that are great for Knox County.
Excellent.
Some really nice school records broke during.
Oh, yes. Yeah. Calvin Heighthouse broke his own personal record and won at Mount Vernon.
Just want to say congratulations to the winners and those that were part of the acceptance awareness luncheon yesterday. It was very nice, well done, and congratulations to you.
I'll look for a motion to adjourn.
So moved.
We stand adjourned.